patients who will benefit most from a care plan would particularly involve individuals with chronic illness who will be in this medication boat for a long time and who have a chance to learn about the process of care and get a successful plan for the future. People whose status might be declining or otherwise suboptimal in terms of their being able to comply completely or adhere appropriately. People who might be geographically challenged, people who have problems with access to care, who might need to do some emergent things on their own. For example, one of my patients who lives a couple hundred miles away in West Virginia, who really needs to know how to take care of their asthma on an urgent basis when they're out in almost next to the middle of nowhere, and how to make sure that they contact us well beforehand. Any type of complex care will benefit from care plans, as well as people for whom their health status is pretty good commonly, but they might have intermittent emergencies, particularly people with asthma, for example, who might be just fine most of the time, but in an acute asthma attack really need a clear plan to follow so they can treat themselves and get access to care most appropriately. For example, there have been two interesting studies in asthma which pertain to care plans. One study by Cowie looked at patients who had presented to the ER and they were given a written action plan for their asthma care and then followed over the next 6 months. And in the group who were given action plans, and I'm using that as an example of a plan of care, not a complete one, but one that is a good example of something that's written out and conveyed to the patient one-on-one. There were 5 follow-up visits among 48 patients to the ER. In people who didn't receive their action plan, there were 56 visits in the 48 patients who did not receive any written instructions on how to follow up. That's just one example of the big impact that a patient care plan can make